We all see, hear, and feel things when we're dreaming. I'm just someone who cannot turn off my nightmares even when I'm awake, explained Cecilia McGo. In her TED Talk, she's talking about her experience with schizophrenia, a chronic disorder that affects the way you experience the world. It's one that is highly stigmatized and misunderstood. To better explore what exactly schizophrenia is, in this video, we will be diving in to see what exactly is it. According to PsyCom, schizophrenia is a psychiatric disorder with significant cognitive, behavioral, and emotional symptoms that affect how you experience the world. Typically, people with schizophrenia experience psychosis, a cognitive symptom in which you experience reality differently than the people around you. This can be terrifying for some people. Psychosis can take the form of hallucinations, physical sensations that aren't actually there. They may also have delusions that are false beliefs that cannot be changed. People with schizophrenia also commonly experience different negative symptoms, which we'll get into. The DSM-5 explains that people with schizophrenia experience delusions, hallucinations, or disorganized catatonic behavior. These are considered positive symptoms, though they are not typically a good thing. For some, psychosis can be a terrifying experience. For others, they may feel they have a grandiose purpose. There is no one size fits all. These can occur with negative symptoms, which include feeling a complete lack of pleasure, little interest in socializing, and limited emotional expression. They may be withdrawn and asocial. Typical onset, or prodrome, is in a person's 20s, but can occur both early in life and later. Symptoms must occur for at least a month. Schizophrenia is different for everyone. It has a number of different symptom combinations, which can affect the person in different ways. Negative and positive in these contexts refer to the types of symptoms. Where negative symptoms are usually the lack of something, like emotional expression, positive symptoms are the addition of them, like psychosis. What is psychosis? Psychosis is a hallmark symptom of schizophrenia and is considered a break from reality. When you're in psychosis, you may see and hear things that are not really there. Similarly, you may have odd beliefs and thinking that is bizarre to those around you. These tend to occur in episodes, where symptoms will be much more pronounced than at other times. Symptoms occur in stages, with a building onset, an active stage with psychosis, and a residual stage afterwards with lingering symptoms. While a person with schizophrenia may recover from a psychotic episode, they may still have odd behaviors and beliefs, though less severe. Hallucinations. According to Medical News Today, hallucinations come in many forms, most commonly hearing voices or seeing things, though these things can affect any of your senses. Hallucinations can be hard to identify as they may be subtle, like seeing or feeling bugs on you or hearing someone speak from another room. In other cases, they can be quite prominent, such as seeing beings like aliens or religious figures. While sometimes fantastical in nature, they can be incredibly realistic. In some cases, they are recurring, with certain hallucinations coming back in a psychotic episode. A person may be able to, in time, recognize that they are hallucinating, but sometimes they are so realistic that it's impossible to tell. Hallucinations may interact with you and can say, do hurtful things to you. Fortunately, with proper medication, these hallucinations can be reduced in severity, even eliminated. Delusions. Mind.com defines delusions as beliefs that conflict with reality. These are fixed, false beliefs that go against those of the people around you. They can be bizarre in nature and are sometimes paranoid. There are several types of delusions, mainly persecutory or automatic, somatic, and grandiose. People with delusions may believe that people are out to get them, like the government, persecutory, or that a celebrity is in love with them, erotomantic. They may also believe that they have an illness, somatic, or a grandiose purpose in life, like being a religious figure, grandiose. Their methods for coming to a certain conclusion may be bizarre, but firm. Delusions are fixed beliefs that cannot normally be changed. For instance, someone with a somatic delusion who believes that they have a parasite infection is convinced they have it, regardless of what medical professionals tell them. Someone without schizophrenia would typically follow their doctor's word. Delusions feel real to the people experiencing them, just as we feel our experiences are real to us. Other terms. When talking about schizophrenia, there are a number of terms that will come up. A few of them are anhedonia. This is an inability to feel pleasure and is a negative symptom. You won't feel enjoyment out of anything, even if you normally would. Catatonia is an increased struggle to move or respond to environment. You may have odd movements that are inappropriate to your surroundings. Anosognosia is a lack of insight on how schizophrenia affects the person with it. You may not be aware of your symptoms or how it affects you. Schizoaffective is a similar but separate condition that is a combination of schizophrenia with a mood disorder like depression or bipolar. What it's not. Because schizophrenia is so misunderstood, there's a lot of stigma surrounding it. Some of the common misconceptions are that it deals with multiple personalities or that people with it are violent. Schizophrenia is commonly misunderstood as dissociative identity disorder, which used to be known as multiple personality disorder. This is a condition characterized by having at least 2 different alter states. A person with DID may switch into different alters that have their own personality, behaviors, and memories. While these 2 conditions overlap in some ways, the symptoms and treatment are vastly different. Schizophrenia is not inherently a violent condition. Schizophrenia does not have a higher statistic of violence than the general public, and you can probably name incidences where people with the condition have harmed others. However, this is still rare. According to Cambridge University Press, less than 10% of people with schizophrenia commit violent acts. And there may be other factors in those cases like substance abuse. People with schizophrenia are far more likely to be victims of violence than perpetrators. Those that do have violent tendencies, like anyone, can be treated. Let's look at treatment. Unfortunately, schizophrenia cannot be cured, but it can be treated. According to National Alliance on Mental Illness, schizophrenia is treated with medication, like antipsychotics for the positive symptoms. Psychotherapy can help manage the negative symptoms. Medication takes trial and error to find one that works the best, but is highly effective. When in a psychotic episode, you may need to be temporarily hospitalized to stabilize. While this can be unpleasant depending on the circumstances, the goal is to stabilize your condition. With proper management, these hospitalizations can become few and far in between, with some never having to be hospitalized again. People with schizophrenia can live fulfilled and successful lives despite all the potential challenges they may face. Schizophrenia is not one size fits all. Many people are able to live fruitful and successful lives with the proper treatment. John Forbes Nash, the subject of the film Beautiful Mind, was a highly acclaimed mathematician who won a Nobel Prize and had schizophrenia. There are countless others throughout history and in your community. Let us know if you found this video educational by giving your thoughts on this topic. If you're comfortable, feel free to share your own experiences with schizophrenia.